Hi, welcome back to the last lecture on the immune system, which is a rather topical unit considering the pandemic that we're living through at the moment. Perhaps you have a sense of living history, or what will become history, in rather lots of important ways. So let's do a little bit with vaccinations, which is a popular topic right now. So the more you learn about those, I think the better. So here are the few slides that we have left to go through. So one thing that I would like you, a couple of things I would like you to remember. So let me write these. Oh, geez, it'd help if I could start spelling. It's difficult for me to write and talk at the same time. So where have we been? What have we talked about? Well, we've talked about T and B cell activation. Along with non-specific immunity. And B and T cell activation is part of specific immunity to a specific antigen. For example, e.g., COVID-19. Is infecting people, and those that are fighting the infection have gone through B and T cell activation, assuming they have a normal functioning immune system. And on the B cell side of the story, remember that we cloned plasma cells, and the plasma cells produced antibodies. And we also looked at a primary and a secondary immune response. As measured by antibody titer. So that'd be another point to remember, is that serum blood, serum antibody titer determines protection. It's a major factor in protection. And that's what we're doing with vaccinations, is that we are trying to increase this serum antibody level for protection. So let's go ahead and take a look at a little of this. The next couple of slides are talking about data that, as if somebody needed convincing that vaccinations are worthwhile. So the details of how the vaccine works I've already gone through. And that is basically this story for how vaccines work. So you may want to review that and be clear on how vaccinations prime the immune system to fight a specific disease. Don't forget also that there are non-specific processes of disease prevention, such as washing hands, physical barriers, etc. So, this is a good graphic. I like it. And what it shows is the effect that vaccines have had on infectious diseases. So what we have on the left, as represented by these syringes, and the numbers are very tiny and difficult to read. You may have to zoom in on the PowerPoint slides that I gave you, but this is morbidity in the United States every year. So it's annual. So this is the number, and morbidity is different from mortality. So morbidity is not equal to mortality. Morbidity is getting sick, and mortality is dying. So you can get sick and not die. And in the news, you may be hearing about COVID patients that have comorbidities. So all this means is that the person had underlying health concerns or health issues, such as maybe they have hypertension or diabetes or obesity. Those would be comorbidities. So then when you get infected with COVID-19, you have these underlying morbidities or conditions, and the prognosis is not as favorable for outcomes. So back to the diagram, what this shows on the left is the annual morbidity every year and for these different diseases, and on the right are the cases of the disease that have been reported. So for example, on the left, this is before the vaccine. So this is pre-vaccine data. So every year before the vaccine, there were, it looks like 21,000 some odd cases of diphtheria every year. They didn't all die, but a number of them did. I don't know what the mortality rate is, but after the vaccine was introduced, the rate or the percent went to 0. Basically, it eliminated diphtheria. Haemophilus influenza, every year there used to be about 20,000 cases of that. And after the vaccine, down to 263, which is a 99% reduction. So not everybody who's vaccinated is protected. And you just go on down the list, and I think you can see the general trend. Hepatitis A, there are 117,000 cases of Hep A. After the vaccine, it goes down by 91%. Hepatitis B reduced by 83%. So there's still 17% of the people who get hepatitis B vaccinations and still get sick. It's not a guarantee, but it's if you're playing the odds, it's the way to go. Measles, 99%, etc., and you get the idea. Pertussis, we talked about that earlier, bacterial infection, and there was an outbreak of pertussis in Yakima County several years ago. Not everybody was vaccinated. And etc. Polio, 100%, rubella, smallpox, tetanus, chickenpox, etc. Childhood diseases killed many people before the advent of the vaccines. So the next slide is a little different picture, but the same idea, different data set. And here, this is showing the number of deaths per month among 11-month-old children in Mexico. So I don't know what part of Mexico, but the source of the information, if you want to look it up, is in the New England Journal of Medicine, which is a premier medical journal. So it's been vetted and peer-reviewed, It should be really good data. And what it shows is that over a series of years from 2003 to 2007, or 9 rather, for that set of data, each year there is a spike in deaths among 11-month-old children due to diarrhea. And they would just desiccate and electrolytes get out of balance and they die. After the vaccine was introduced here at the red dot, you can see that the number of these illnesses declines. So it's just supporting evidence of the efficacy or how well vaccines work to prevent diseases. Presumably you don't need convincing on this, but there are some people that still don't get it. So what I want to spend time on is this idea of herd immunity. And it is an important concept that I want you to understand. I wrote this slide earlier before COVID-19 when the main issue I was trying to get at were people that just don't believe in vaccines. The anti-vaxxer crowd. I don't know where they stand now, but I am going to explore this idea with you because I want you to understand it. So we're going to talk about herd immunity. And the link, if you can open this up, will take you to a Wikipedia article, and I took the graphic out of that article and put it in the next slide. So this is the graphic slide out of that Wikipedia article. I like it for a number of reasons. It was written to show the effect of vaccines. So let's, since we don't have a vaccine at the moment to COVID-19, let me use this graphic to illustrate what happens when you don't have a vaccine present. So the idea is that the people in blue up here are not immunized. That means everybody, because there is no vaccine. And what happens, so this is sort of illustrating social distancing, or what happens when you don't have social distancing. We don't have a vaccine at the moment. So the population is all blue right now. And those people that get sick with COVID-19 are in red. So I'll put a little yellow dot. Those are the infected individuals. No vaccine for anybody. And when people are in close proximity to them, you know that the virus is spread through droplets. Somebody sneezes, breathes heavy, coughs, whatever. The droplets go into the air. They hang in the air for a while. And somebody nearby walks by and breathes in the virus, and they get sick. And this virus is particularly contagious. So without social distancing, you can see what happens is that the disease just spreads. And then when you after time, lots of people are sick. Most of the population can get sick. So this is, New York City as an example. But any other place where the outbreak occurs, this is the result. And it has devastating consequences because there is no protection. So the only way to prevent the spread of disease is to separate. And this illustration is not showing that because it wasn't intended to show that. But I hope that gets the idea across. If you just have more space between people, they're not going to be walking into the droplets. And it doesn't take a lot of droplets apparently to cause infection. Okay, so that's the idea of social distancing. You just have to physically separate people to where they're not in close contact. And that's what we've been doing and we're continuing to try to do. And of course, there's social discontent over that. It's terribly disruptive to normal social life. So let's go now to back to the idea of herd immunity and vaccinations. So we did I introduced this idea of social distancing, and let's now deal with herd immunity. And herd immunity is with a vaccine. Which again, we don't have at the moment. But when you do have a vaccine, then this idea of herd immunity kicks in. So, back to the illustration. What it's showing here is, again, the blue are unvaccinated. The key up at the top of the figure, the yellow people are immunized, and the red people are sick and contagious. And again, without a vaccine, we get the same picture as at the top, in where nobody is vaccinated. Now, in the middle panel, you vaccinate a number of people. It's not very common. There are 2 people. I meant to go yellow. There are 2, 3, 4, 5, 6 people that have been immunized, and the same 2 people in all of these figures are getting sick. So now in the middle panel, part of the population is vaccinated, but there's still not enough, and the infected people or the susceptible people in blue still get sick and infect much of the population. Those that were vaccinated are protected in yellow again. So these people are in the same position as in the other figure. They're protected, and the disease still infects a large number of the population. Not everybody in the population gets infected. There are some lucky individuals. Maybe they are on the edge of the population. Maybe they're socially isolated enough, so it's not 100%. And then on the bottom panel, if you get enough of the population vaccinated, this is the herd immunity. Or community immunity, or population immunity, social immunity, however you want to call it. But this was originally sort of worked up, and the idea came out of agriculture, where if you vaccinate enough of your herd, you don't need to get every individual in the herd, you just need to get enough to break the spread of the disease. So again, here are the infected individuals, the same 2, the yellow dot in the center of their red figure, and surrounding them are immunized people, and the blue ones, the 4 blue that were not vaccinated, not immunized, are able to not get the disease only because there are enough people that are vaccinated to protect them. So this is what irks a lot of people about the anti-vaxxers, is that they claim they don't need to be vaccinated What they don't realize is that the only reason they can get away with not being vaccinated is that enough people in the community have been vaccinated to protect them. And then here are those individuals. And there's another poor unlucky guy here that I don't know what happened to the fourth one. But at any rate, these individuals, there's still some that get sick. One got sick over here. Or these are the ones that didn't get immunized. And the disease still gets those two, and it got one other person infected. So I hope that helps for this idea of herd immunity. You need to get enough of the population vaccinated. And this slide again was done before COVID-19. I frequently would get questions about autism. I don't think anybody that I've come across recently believes this, although I'm sure there are folks out there. If social or conspiracy theories die hard, and if you have any doubts about it, this is a pretty good article to read. It does a pretty good job of sort of explaining this business of autism and vaccinations. There never was really a connection. There was very little weak evidence at the beginning. It was probably more of a correlation. It has not panned out. It's been debunked. It's been thrown away. And anybody who continues to believe that, in my opinion, is sort of exposing their ignorance on the topic. And the final slide is just some reference for you. There are a couple of sites that deal with childhood vaccinations that are pretty good. These are, the CDC and the National Institutes of Health. This is not Facebook. This is backed up with lots and lots of well-designed experimental data. And then I put in some links for COVID-19. National Johns Hopkins has done a really good job with some live maps. I stumbled across the Seattle Times website, which has done a good job of summarizing Washington State data. And then the CDC again, their homepage for COVID-19, and then the Yakima Health District. So if you're looking for information, those are pretty good sites. And that's it. Thanks. And if you have questions, get a hold of me on email or the discussion board or during office hours.